Hey everybody, it's Dr. Leslie here, and today we are going to be talking about an important health news topic, hepatitis outbreak in kids.
If you like this topic and video, make sure to hit the like and subscribe button below.
So recently in the last few months, there have been noted to be an increased number of hepatitis cases that were happening in Europe and now in the United States. And it's a bit of a mystery because we don't know exactly what's causing it. And we have a potential, not really new cause, but unexpected cause that could be linked. So let's get into it today. First of all, let's talk about what hepatitis is. So hepatitis is inflammation and damage to the liver. Now, this can be a little bit confusing because hepatitis, we think of like hepatitis A, hepatitis B, hepatitis C, right? That's what comes to mind immediately. But those are viruses that actually cause hepatitis. Hepatitis itself is just the damage and inflammation to your liver. And hepatitis can happen in kids, it can happen in adults, and there's a lot of different things that can cause it. But it is something that is really serious condition that needs to oftentimes really be treated in the hospital, and we need to figure out why this hepatitis outbreak is happening. So what normally causes hepatitis? The things that usually cause hepatitis are of course, the hepatitis viruses like we talked about, right? Hepatitis A, B, C. Those are the things that we always hear about. Now, those infections can cause hepatitis acutely, meaning a big flare-up of hepatitis, or they can cause kind of chronic, low, smoldering hepatitis and liver inflammation. But there's a bunch of other stuff that can cause hepatitis as well. Now, sometimes in adults, we often think of things like, alcohol, excessive alcohol use, or accidental Tylenol overdose, things like that can cause acute hepatitis, meaning quick, big flare-up of inflammation in the liver. In kids and in adults too, there are some other things that can cause it. There are other types of viruses that can cause hepatitis, like Epstein-Barr virus, for example, EBV. CMV is another one that can cause hepatitis. There's numerous others. And then also there's some autoimmune conditions that can cause hepatitis too, and more. There's a bunch of stuff that can cause hepatitis. Now, what the heck is causing this hepatitis outbreak to be happening? So doctors and health experts, public health experts have been looking into this and finding that the typical stuff that causes hepatitis, they're not finding that in these cases. And so they've been looking into all the things that we talked about, things that can be potentially causing hepatitis, and they haven't found any of them. Oddly enough, they have found a decent number of kids who have tested positive for something called adenovirus. Now, not every kid who has had hepatitis recently and is in this group has had adenovirus, but it is a decent portion that has tested positive for adenovirus and this strain of adenovirus called strain 41. We typically do not see adenovirus as a cause of hepatitis in kids who have kind of normal standard immune systems and healthy kids. So it's a bit odd that this is showing up in the group of kids that have hepatitis right now. So what is adenovirus? Adenovirus is a really common virus in kids, in adults, and it usually causes cold and flu-like symptoms. So typically people will, get a cough or a little bit of a sore throat. They might get some upset stomach, throwing up, diarrhea, things like that. Pretty kind of standard cold symptoms and some kind of gastrointestinal symptoms as well. And usually that's it. That's what happens. We say, okay, it's not something we usually test for because it's usually pretty common, causes a cold, causes some upset stomach, and then it gets better, right? But if this is the link, and if adenovirus is what's causing hepatitis in a lot of these kids, then we need to be thinking more about what symptoms we need to be watching out for to see, could my kid also have hepatitis right now? So it's really important that we are monitoring for signs of hepatitis. So the kind of bothersome or difficult part about this is that hepatitis, the symptoms right away, they start off as kind of broad, right? So people might feel fatigued. Sometimes people get a fever. They get some upset stomach. They might have some diarrhea, some nausea, some vomiting. And usually from there, it progresses. And so oftentimes we'll see a lot of abdominal pain, really significant abdominal pain. People may develop something called jaundice. Jaundice is something that can happen with hepatitis where the skin can turn a yellowish hue. And it can be easy to see in some skin tones and a little bit more difficult to recognize in other skin tones. But one way to really look for jaundice is to examine the whites of people's eyes. And if you notice that the whites of the eyes are becoming yellow tinged, that's something that's really important, a kind of a way to recognize, this could be hepatitis, we need to be seen. It can also cause things like darkening of the urine. So that's something else to watch out for. So if you've got a kid who, let's say they get a common cold, type situation, they're coughing, they're feeling fatigued, they start, having some diarrhea, throwing up a little, and the whites of their eyes start turning yellow, their abdominal pain gets really bad, and they just overall seem like they're getting worse. They need to be seen right away. That's when you would be concerned about potential hepatitis situation and need to get evaluated for it. So how do you go about preventing your kid from getting this? First of all, I just want to reiterate the fact that this is incredibly rare. These cases are very, very rare. They're not happening often. And so I want you to be aware of, potential symptoms that could be things that could come up if a kid has hepatitis. And I also want you to know what you can do to protect yourself and your kids. But also, I don't want people to be fearful, right? Just be aware, recognize the symptoms so that if something comes up, you can get your kids seen right away for it. So let's talk about how to protect yourself. So if these cases are being caused by adenovirus, then I want you to just remember general preventative measures, right? So adenovirus can be transmitted by, somebody coughing near somebody else, or somebody shaking hands with somebody who has some of it on their hands. So you really want to be careful and just practice regular preventative sanitary measures, right? You want to be washing your hands. You want your kids to be washing their hands, cover your cough, wear a mask if people are feeling sick, or just stay home if you're feeling sick, if your kid's feeling sick, or, if you have family members who are going to come over, but they've got a cold, I would say, hey, maybe you should stay home or wear a mask and we can meet outside, that kind of thing. So just kind of regular safety tips can help prevent this kind of thing. Another really important question, do the hepatitis vaccines protect against this? So the hepatitis vaccines protect against very common causes of hepatitis. Remember, hepatitis is just inflammation of the liver. The hepatitis vaccines protect against the hepatitis viruses, hepatitis A, hepatitis B. And those are common causes of hepatitis, right? And so, yes, getting your vaccines will protect against hepatitis, but we don't have a vaccine for adenovirus. And so if that is what's causing this, or if there's a connection, the hepatitis vaccines won't play into that. They are important though, so make sure to get your kids vaccinated against hepatitis. Little update here. So many people have been asking about, could this be related to COVID infection or the COVID vaccine? And there has been investigation into this, and they have not seen COVID or the vaccine itself being related to this hepatitis outbreak. And for a lot of kids, they aren't even old enough to have gotten the vaccine yet. And so this is not something that at this point has been considered connected to COVID or the vaccine itself. Where can you learn more? I would recommend that you take a look at your State Department of Health website. You can go on the WHO or the CDC. Those are all great places. I've listed them down below, and you can take a look, get updates on the situation, and see. So in summary, there is an outbreak of hepatitis cases, although there are few of them, they're rare, but they are happening kind of more often than usual. And we aren't exactly sure what's causing it because we've looked into all the kind of common causes of hepatitis in kids and haven't found any of them. The thing that we're looking into more now is adenovirus as a possible cause or a possible link related to these hepatitis cases. So make sure to practice regular sanitary measures, get your kids vaccinated against the hepatitis viruses, and just be aware that the situation is going on. Finally, this situation is evolving and we're learning more about it every day. Remember, science is something that can change. We may have an idea about, could it be adenovirus, and we do more research and things can change. So I will keep you updated as we go along. Please ask questions in the comments and I can potentially make a part 2 about this when we learn more information. All right. Well, thank you so much. And hit that like button, hit that follow button, and we'll see you at the next video. Bye.